We've all been there, right? That sudden twist, that sharp pull, that ache that just stops you in your tracks. Whether it's a sprain, a strain, or that dreaded back pain, what you do in those first few moments, well, it can make all the difference in how you recover. So let's get right into it. So picture this. You're out for a jog. Maybe you're just stepping off a curb funny, and boom, you feel that sharp, sudden pain in your ankle. Or you bend over to pick something up and your back just seizes up. What you do in the next 48 hours is absolutely critical. The real question is, do you actually know what those first right steps are? Okay, so before we can even think about treating the problem, we gotta know what we're actually dealing with. And the very first step is getting the difference between the two most common culprits, a sprain and a strain. They sound almost the same, I know, but they affect completely different parts of your body. All right, let's talk about a sprain. This is all about your ligaments. Now, ligaments are those super tough, fibrous bands that connect one bone to another. They're basically what holds your whole skeleton together. The best way to think about it, imagine a rubber band. If you stretch it way too far, it gets damaged, it gets frayed, or it might even snap. That's pretty much exactly what a sprain is. A strain, on the other hand, well, that happens when you injure a muscle or a tendon. Tendons are the tough cords that connect your muscles to your bones. So if you've ever heard someone say, "Oh, I pulled a muscle," what they're really, truly talking about is a strain. So let's boil it all down. The bottom line is this. Sprains are about ligaments. That's bone-to-bone connection. Strains are about muscles or tendons. That's muscle-to-bone connection. And look, knowing this one simple difference is the key because it helps you understand what's hurt so you can start the right kind of recovery. All right, so now that we've got a better idea of what might be going on inside your body, what do we do about it? Let's get straight into the immediate action plan for those first super critical hours right after an injury happens. You know, the gold standard for treating these things right away is a simple little acronym, RICE. That stands for rest, ice, compression, and elevation. Rest is obvious. Stop what you're doing, get the weight off of it. Ice for about 15 to 20 minutes every couple of hours is going to help with pain and swelling. Compression, like with an elastic bandage, gives some support and also helps keep that swelling down. And finally, elevation. Get that limb up, ideally above your heart, to help drain fluid away from the injury. It's simple, it's effective, and it is your absolute first line of defense. Now, the RICE method is fantastic for minor stuff, but let's be real. Home care isn't always enough, and knowing when to stop treating it yourself and actually go get professional help, that's crucial. So here are the red flags you need to watch out for. If you experience any of these, it is time to call a doctor, no question. If you heard or felt a distinct pop when it happened, if you literally can't move the joint or put any weight on it, if you feel any numbness at all, or if it just looks wrong, deformed or out of place, those are serious signs. And hey, even if you don't have any of those, if it's just not getting better after a couple of days of RICE, go get it checked out. Okay, so you've made the call, you need a professional. But now what? Where do you even go? Usually, your two main choices are going to be an urgent care clinic or a specialized orthopedic clinic. Let's break down how you choose the right one for your situation. Think of it this way. Urgent care is a fantastic option for that initial diagnosis, especially if the injury isn't super severe or if it happens after hours. They can do x-rays, get you a basic splint, and help with pain. But for more complex problems, chronic issues, or for your follow-up care, an orthopedic clinic is really the way to go. That's where you'll find deep expertise, advanced imaging like MRIs, and you can even talk about surgical options if it comes to that. Let's switch gears for a second and talk about one of the most common complaints on the planet, low back pain. And we are going to tackle a huge misconception, this rush to get an X-ray or an MRI right away. First, I just want you to see how common this really is. A staggering 80% of adults will deal with low back pain at some point. That's 4 out of every 5 of us. So if you've ever felt that ache, you are definitely not alone. So since it's so common, it seems totally logical to want to see a picture of what's going on in there, right? An X-ray, an MRI, something to show us the problem. But is that really the best first step? Well, the answer from the experts over at the American College of Radiology is a pretty loud no. And this might surprise you, but for most cases of new, acute low back pain, they recommend against imaging for the first 6 weeks. And there's some really solid reasoning behind that. So why wait? Well, for starters, most back pain actually gets better on its own with things like physical therapy and just modifying your activity. But here's the other big reason. An MRI or X-ray will almost always show normal age-related changes. Think of it like gray hair, but on the inside. These things usually aren't even the cause of your pain, but seeing them can lead to a ton of unnecessary anxiety and maybe even procedures you don't need. The focus should be on gentle recovery, not just on getting a picture. Now, of course, there are always exceptions. These are the red flags for back pain. If the pain started because of a major trauma, like a car accident, or if it comes with things like a fever, progressive weakness in your legs, or loss of bladder control, then yes, imaging is absolutely needed right away to rule out anything more serious. So what's the big takeaway here? It's that good medical care is all about treating the person, not just a picture on a screen. Your story, your symptoms, and a physical exam, those are the most powerful tools a doctor has. The image is just one piece of a much, much bigger puzzle. At the end of the day, from a twisted ankle to an aching back, your body is constantly communicating with you. It's an expert at sending signals: pain, swelling, weakness. By understanding what those signals mean and knowing how to respond, you become an active partner in your own healing. The real question isn't just what to do, it's, are you prepared to become an expert at listening?